2024 and 2025 have been landmark years for healthcare across Hampshire and the Isle of Wight. Together, we've celebrated new beginnings, strengthened partnerships, and made lasting improvements to the way we care for our communities. Let's take a look back at some of the key moments from this remarkable year. In April 2024, we launched the Hampshire and Isle of Wight Healthcare NHS Foundation Trust Clinical Operating Model, based on evidence, best practice, and feedback from our patients, families, carers, and staff. We will embed a culture and practice of continuous improvement, innovation, and research to deliver high-quality care, and all decisions about care and treatment will benefit from both lived and learned experience. May saw important steps in bringing services together. Community, mental health, and learning disability services from the Isle of Wight NHS Trust officially joined Southern Health. We also welcomed the No Wrong Door team from the Integrated Care Board. We celebrated International Nurses Day with our first joint conference, a moment of unity across the three trusts, shining a spotlight on the incredible values-led contribution of our nurses and allied health professionals. Following child and adolescent mental health services, also known as CAMS, joining Southern Health in February, and further services from the Isle of Wight NHS Trust in May, we focused on the final stage of creating the new trust, which involved bringing Southern Health and Solent NHS Trust together. In July, we launched Connect Over a Cuppa, a fun way for colleagues across Southern Health and Solent to meet someone new. Staff were paired at random and invited to share a 30-minute chat over coffee, virtually or in person. It was a simple idea, helping over 200 people connect, share experiences, and build a values-led culture within the trust. In September, Solent NHS Trust helped secure the future of local GP services on the Isle of Wight, taking on the management of Medina Healthcare. Plans were announced for a new, modern facility at Riverway House in Newport, giving patients greater access to timely face-to-face care. October marked the most significant milestone of all. On October 1, 2024, Southern Health NHS Foundation Trust formally joined with Solent NHS Trust to create Hampshire and Isle of Wight Healthcare NHS Foundation Trust. Our new trust now employs 13,000 staff, caring compassionately for a population of over 2 million people, with an annual budget of £889 million. Our team works across more than 500 sites, delivering outstanding care within our communities. By bringing together services from 4 previous NHS trusts, we aim to reduce duplication, improve access to care, and ensure consistent, high-quality services across the region. From October onwards, we also began months of co-production on our new 5-year strategy, shaped by thousands of voices from staff, partners, patients, their carers, and communities. This values-led approach ensures our future priorities truly reflect what matters most to the people we serve. November was a month of recognition and pride. Our apprentices shone at the News and Observer Apprenticeship Awards, with Danielle Doyle winning the Health and Public Service Award. We were honoured at the Alice Ruggles Trust Awards for our partnership work tackling stalking, and our Older People's Mental Health team were named Psychiatric Team of the Year by the Royal College of Physicians, recognised for their pioneering collaborative approach to older people's care. As the festive season approached, we highlighted the extraordinary efforts of our staff helping patients, where feasible, return home for Christmas. Stories like 20-year-old Amy, who returned home after specialist rehabilitation following a life-changing accident, and a 90-year-old Margaret, who regained her independence after a fall. Each reflecting the dedication, compassion, and outstanding care at the heart of our services. January 2025 brought exciting digital innovations. We launched the CAMS Academy, the first online academy in the country dedicated to recruitment, development, and research in children and young people's mental health. We also launched a new website for our trust charity Brightaway. The website has a new design and features supporting the charity's vision to enable people to lead a brighter life through the use of fundraising and grant-making for projects. We also received planning permission to redevelop Riverway House in Newport into a new GP surgery, a vital step in building sustainable primary care on the Isle of Wight. February marked the official opening of the South of England Rehabilitation Centre in Southampton, a state-of-the-art facility uniting 4 rehabilitation wards under one roof. We also welcomed our new chair, Neil Hayward, who will guide the Trust into the next chapter of its journey. In March 2025, we opened 2 brand new facilities. The Newport Health and Wellbeing Centre on the Isle of Wight, the first of its kind, bringing together mental health and community services in a modern, accessible space. And the Fareham and Gosport Child Development Centre, a transformed facility designed to centralise and future-proof children's health services for local families. March was also a month of celebration and national recognition. Our innovative Careers for Young People programme won Best Educational Programme at the HSJ Partnership Awards. And we marked 10 years of the Hampshire Family Nurse Partnership, a decade of improving the lives of young mothers and babies across our communities. Looking back, this has been a year of progress, partnership and pride. From strategies to services, from recognition to new beginnings, every milestone has been about one thing: delivering outstanding care for the people of Hampshire and the Isle of Wight. We would not have been able to deliver this without the amazing hard work of all our staff, who do so much to deliver care, often in challenging circumstances. Together, proudly living our care values, we continue shaping a healthier future for all, where people thrive and our communities are the strongest they can be.